Yeah, so CLL is a really exciting disease because there's been a ton of progress and we have a lot of great tools in the toolbox right now, but there's still unmet needs for heavily pretreated patients, Richter's transformation, and this question of sequencing therapies as well. I would tell young investigators to find, a patient population and disease space that you're really passionate about exploring. I think with CLL in particular, there's a lot of a heterogeneity in the patient population. So there's some patients who don't require any therapy, but still require oncology care and particularly supportive care because there's immune consequences of having CLL, even when your CLL is not treated. So I think that's a future area that's ripe for young investigators to investigate. How do we restore the immune system? How do different treatments impact the immune system to really decrease infections for CLL patients? And then ongoing clinical trials and as well as looking at kind of real world data. Retrospective series is a good place to start with research. And there's many questions that we're not going to have the answer to with clinical trials that can really be explored first by retrospective data sets. So I think there's a lot ripe for young investigators in that space.